Hi, Michelle Giannato here, Vice President, Patient Advocate for the nonprofit Auto-brewery Syndrome Information and Research. I'm doing a follow-up video explaining a little bit more about what had happened to my husband with developing auto-brewery syndrome and the challenges of caretaking. My husband and I were dating in September of 2015, where he decided that he needed to get some nasal surgery done. He had a deviated septum. It was supposed to be a routine surgical procedure. With any surgery, there's always a risk for infection. And with his surgery, he did develop a post-op infection. We had gone to the hospital about a week after his surgery, and they had admitted him for observation, put in IV and administered IV antibiotics, and he was also released with a script for oral antibiotics for 10 days, which he took. While he was on these antibiotics, we found that he had uncontrolled blood sugar, he was vomiting all the time, and we just chalked it up to he's having side reactions to the antibiotics. Once he was done with the antibiotics, we had a visit with his surgeon, a follow-up visit, and the doctor had noted that he was very dehydrated, he didn't look well, and told him he wanted to look up his nose with the scope, and he did. And he said, well, the infection's gone, so I don't know what's going on with you, but you certainly don't look well. And we explained to the doctor the vomiting and the uncontrolled blood sugar, and we didn't know what was going on. And he said, look, your body has been through a lot with the infection, the antibiotics, you need to get back to health, so just stay hydrated, and if there's a problem, let me know. For the next month and a half, again, uncontrolled blood sugar, slurred speech, which I noted was happening after his dinner. He wasn't really a breakfast or lunch eater. He would have his biggest meal at dinner, and he was very tired afterwards, and he'd be slurring his speech. He was unable to walk certain nights. He was had intermittent fevers. He had unusually high blood pressure, and he was missing a lot of work from constantly sleeping for days, and I couldn't figure out what was wrong with him. On Halloween weekend, we had friends come over for dinner, and we had made steak and potatoes and corn and garlic bread, and we ate dinner. And about an hour or so after dinner, he wasn't feeling well, and he said he had to lay down. And this was just another repeat of what had been going on for the last month. He would eat, not feel well, go to bed. Sometimes he'd wake up vomiting, and my friends were concerned, or his friends too. What's going on? He's not right. And I said, ever since the surgery, we just can't figure out what's wrong with him. I keep bringing him to doctors, and we had been seeing his primary. We went back to his surgeon, and nobody could figure out what's wrong with him. The next morning, I didn't feel like I could leave the house. I had this feeling like something bad was going to happen. I had taken a shower. I came out of the shower, I got dressed, and he was still sleeping. And I left the bedroom. I went into the kitchen to make something to eat for myself for breakfast, and all of a sudden I heard him coughing, but it wasn't a normal cough. There was something more to it. So I ran in the bedroom, and I found he was on the bed having a full-on seizure, vomiting, and his eyes were rolling back in his head, and he was shaking on the bed. I rolled him over, I cleared his airways, and I grabbed the phone and I dialed 911. The paramedics and police rushed here, and they wanted to know what was going on. And I said, honestly, I have no idea. He's been sick since his nasal surgery. He was on antibiotics. He's been having all these strange symptoms, and I didn't know what to make of it. He was transported to the hospital by ambulance. He was intubated, and he was in ICU. It was, I don't even know how to describe it. It was overwhelming to see all the tubes and the central line to, in his neck to his heart, and the machines breathing for him. I thought, oh my God, if he even wakes up, is his brain going to work? Is he going to be okay? That was the toughest thing, because he went from having this simple surgery to now he had a seizure, and I didn't know if he was going to come out of it alive or not. One of the ICU doctors met with me, and they had asked me if he was drinking, and I said no, he was sleeping. He just got up for meals. They wanted to know what he ate. Did we have alcohol in the house? And I kept asking, why do you keep asking about alcohol? And they said his body was in alcohol withdrawal. I was so shocked and confused because I couldn't understand where that was coming from. Obviously, he stayed in the hospital, and when I came home, I ripped the house apart looking for alcohol. I ripped his car apart. I thought maybe I missed something. Maybe he was drinking, and I'm just like some dummy that didn't know what was going on. But that wasn't it. If he was drinking, I certainly didn't find the evidence. He was in the hospital about a week. They did eventually take the tube out, with 24 hours later. And he was not able to talk in the hospital because of the tube. But the first question he asked me when he woke up was, where am I? And how long have I been here? That was the hardest couple of minutes, because I realized he had no idea what had happened to him. And I explained to him, you had a seizure. And he didn't remember any of it. So that was very difficult for me. He eventually got released from the hospital because they didn't find anything wrong with him. And they said, if you have a problem, come back. That was very scary, what had happened, because we didn't expect it. They didn't find anything wrong with him, even after a battery of tests, CAT scans, head scans, you name it, they did it. It came up as, nothing was wrong with him. They just thought maybe he was over-medicated with high blood pressure and diabetic medications, but they never really had a diagnosis. So we left the hospital, and we promised, hey, listen, if something happens, we'll come back. Things just continue to escalate. Feel free to go on our website, auto-brewery.org. There are stories in the news. There are case studies for you to download. And I will be making more videos explaining what else had happened after this episode and the difficulties of caretaking.